Today, it is a regular checkup on Paulo Lubega in Bubuunga village, Masaka district. Lubega is getting back on his feet after 4 years of being bedridden.
Luli obulumi bwali bw'amaanyi nnyo nga bwe neebaka wano sisobola na kwekyusa era bankyusa bukyusa ne banziza sayidi eno ne sayidi eno naye kati nsobola kijja mpola ne nsobola okwekyusa nekola ki era kugamba natuuka ekiseera nefuna bed showers mugongo gwonna backbone yonna neggwawo nga kuliko mabwa kati nenfuna munakano omusawo najjanga wano anzijanjaba bw'anteekako eddagala ekyo nakyo ne kiggwawo ate kati okutuusa kati just recently myezi ng'ebiri mpulira ng'amaanyi gagenda gadda mpola mpola yali tekyusa ne neekyusa ekyo ekyokwekyusa kimaze nga emyezi nga 6 nga neekyusa kati bwe kigize mpulira nga amaanyi gazzeemu ne ntandika okutuulako nga ntuula ndi ku buliri naye okutuusa lwe ngize myezi ng'ebiri awo emabega ne ntandika okubeera nti nsobola okugira n'envaayo nenzita ku mu ntebe wano.
Palliative Care Association of Uganda, PCAU, was established in 1999 to support and promote development of palliative care across the country. Its goal was to avail care providers access to resources and skills that would bring relief to those suffering because of chronic and severe pain. It grew from a seed sown and nurtured at Hospice Africa Uganda, one of the few palliative care providers in Uganda founded by Dr. Anne Merriman.
When we started in 1999, it came from that idea that we wanted to work together. And we started just with a small office in the education department, which was headed at the time by Rose and Fatia, who is now in APCA. And from there, we called for a meeting of everybody every quarter.
Rose Chiwanuka was heading the education department at Hospice Africa Uganda. The responsibility of growing the young association of palliative care providers was placed in her hands.
At that time, palliative care was not well known and we needed to do a lot of advocacy. So having people coming together, getting a bigger voice was something which we thought would be important. And when we started, it was about 20 people. The first meeting was about 20 people only. And people were really interested. And it was like, it is our thing. And they could decide what they will discuss the next meeting. And then our job was to identify the right person to give that presentation.
Now celebrating 20 years, PCAU is on a steadfast path of taking palliative care further afield. Palliative care givers reach the most vulnerable patients through a home-based care service for those who are weak or lack the means to come to treatment centers.
I think the biggest role that I played was to persuade and convince that religious leaders have something to bring to palliative care.
Fatia Chiange worked closely with Rose Chiwanuka in PCAU's formative years to ensure that the association got off on a good start.
At that time, the membership was less than 50, really just a loose group. And we set out to really make it a formal association. And one of the things that we did that I contributed to was to even draft a constitution with a view that we get the association registered as a formal non-government organization.
Mobilizing financial resources to get the budding organization up and running was most urgent.
As an accountant, I put money aside to start Palliative Care of Uganda. And the amount of money that I put aside was Uganda shillings 200,000. That was the first money that we gave to Madame Rose Chiwanuka. What she had to work hard was to get the members, people to become members of the Palliative Care Association of Uganda, paid get paid up. Now to do that, you do a lot of running, you do a lot of logistics. There's a lot of logistical work that is needed in order for you to put this together. And so the first seed money was the 200,000.
With the 200,000 Uganda shillings, Rose Kiwanuka and few volunteer colleagues kicked off with the activities of PCAU.
Hospice Africa was very generous. It provided space for these meetings. It provided staff to support the update meeting. But also we had members who were coming from organizations like Maldme. We had also TASO and Kitovu Mobile.
Kitovu Mobile, founded in 1987, has been providing HIV care in Masaka, central Uganda, an area that was the epicenter of the HIV/AIDS epidemic in the late 1980s and early 1990s. As a grassroots provider of care, Kitovu Mobile became one of the first members to join Palliative Care Association of Uganda, PCAU, an organization that brought together palliative care providers so as to advocate for the improvement of service.
Because patients were dying in terrible pain due to AIDS, severe diarrhea, severe painful Kaposi sarcomas, severe herpes zoster, patients were dying in agony. We could give paracetamol, we could give ibuprofen, but it was not enough. And codeine by then, because we used to buy those drugs, they were not helping.
Lubega has received dedicated care from Kitovu Mobile, with carers coming to visit him regularly at his home. Besides assessment and treatment of pain, they offer him other physical, psychosocial and spiritual support. Very crucial to the service he receives is an acute pain management medication, oral morphine.
Obulumi bwali bw'amaanyi nnyo, naye okuva we natandika ono morphine, ne mbeera nga obulumi bukendeera buli lwe ndinywa.
Caregivers like Maria Goretti Nasanga talk of experiencing a moment of peace when patients have access to the right medication.
Nekati eddagala lino bwe yalitandika nabanga obulumi bukendedde obeerawo nomanya nti ewaka ninayo omulwadde wange, naye obudde we naagendera obudde bwonna nja kuba nsobola okukola ki. Naawe nobeerako n'ebyo byokola ki byokola nga toli mweraliikirivu.
Liquid morphine, a restricted pain medication, has become more accessible to patients with chronic and severe pain, largely as a result of the advocacy work done by Palliative Care Association of Uganda.
So our vision from the Ministry of Health is to ensure that we avail these supplies and also to ensure that the people who are responsible for diagnosis and prescribing these medications are there.
Along the way, the public-private partnership was formed, and this has helped to avail the medications that are required for pain control. To us, that is big, and globally, we are actually applauded for that. Because morphine, the government of Uganda pays for the morphine, Hospice Africa reconstitutes it, National Medical Stores distributes it so that the patients who need it can actually access it free of charge.
Palliative Care Association members realized that even when the medication for pain control was made available, prescription was limiting its use, which meant that patients continued to suffer in pain even when the medication was already available.
We didn't have enough prescribers of morphine because at the time only doctors, dentists and vets could prescribe morphine. We only had one doctor at the time, I think, to something like 40,000 people. It's now one doctor to 19,000 people, but it's not enough. In England they have one doctor to 450 people. So the doctors have time to write a prescription for morphine, but here they don't. And the government had agreed to set up a committee in the Ministry of Health that would look at allowing nurses specially trained in palliative care to become prescribers.
Working collaboratively with PCAU, we as a ministry came up with a statutory instrument which would allow the other health workers, specifically the nurses and clinical officers, to prescribe this medication. That has greatly improved the accessibility to to this medication.
Training of health workers in providing palliative care and making it legally possible for nurses and clinical officers to prescribe morphine has extended the reach of palliative care services to almost all parts of the country, starting from the National Referral Hospital, Regional Referral Hospitals, General Hospitals, all the way up to Health Center 4.
Right now, we are almost in more than 100 districts where palliative care is being provided, which was never the case before. And it is because of that kind of collaboration with the PCAU that we have managed to achieve this in terms of training the health workers, in terms of accrediting health facilities, in terms of collecting the data to inform decision making.
In spite of 20 years of hard work, palliative care still faces some challenges.
The deployment of these nurses and doctors who have trained in palliative care, we want them to be deployed appropriately. We want them to be funded so that they can provide the services. Because what we are finding is palliative care is being provided as a by the way. Some of the specialists who have done this training, when they finish, they are deployed like midwives, they are deployed like general nurses. If they were working in theater, they are deployed back in theater. So the opportunity of providing services to those patients who need the palliative care services are not there.
We are still relying on donor funding from abroad. These things should be funded locally. We should have budgets, local budgets for palliative care as a specialty.
After 20 years of collaborative effort, advocacy and a responsive health system, Palliative Care Association of Uganda has a great cause to celebrate and eagerly look towards the future to the many improvements in the years ahead.
Palliative care being recognized in the health sector strategic implementation plan, that means everybody providing palliative care service, providing healthcare services, can provide palliative care as long as they have the knowledge.
PCAU is a fully fledged association with a team of strong, highly skilled, strong staff there. And of course, again, that's really a big milestone in the 20 years. And also there is significant growth in terms of governance for the association.
We must celebrate all the nurses that have been trained by them, all the patients that have received care through the way they have taught people, and the heart that they have brought through to them, and the love that they have shown in when they care. What I want to say is congratulations to Rose and the team at the Palliative Care Association for wonderful work over the last 20 years.